He spent the last 2 years waiting for a life-saving liver donation. Now the nationwide changes in organ allocation that had him searching far and wide for his own donor as he continued to grow sicker. Good morning. It is Friday, December 2nd. I'm Jessica Lovell, and welcome into the Morning Medical Update. We are live inside the Dulcie Simons Jr. Family Broadcast Studio. There was a record-breaking number of liver transplants in 2021. The United Network for Organ Sharing reports there were more than 9,000 transplants last year. That was the 9th straight year that number hit an all-time high. But more and more people are struggling to get a life-saving organ due to changes to the program that decides who receives those precious organs. Make sure to get your questions sent in this morning to us on YouTube, Facebook, and the Medical News Network. You can find links to all of those right there on your screen. You're about to meet our guest today, Gary Gray. But first, here is what it's been like for him and his family for the past 2 years. A lot of unknowns as he awaits his fate in search of that ultimate gift of life.
Okay, let's go say hi, Fizz. If I set a goal for myself, it would be to live another 20 years.
63-year-old Gary Gray misses the simple things, like a long walk or hopping in the driver's seat.
It's real easy to become a hermit in a situation like this.
2 years ago, Gary was diagnosed with a blockage of his bile ducts, a condition that is destroying his liver. Doctors told Gary he'd need a liver transplant.
It was very, very shocking, and my wife and daughter have suffered through this too because they're worried about their dad.
While Gary waits on the transplant list, doctors monitor his MELD score, a number that determines where he ranks on the list of people waiting for a liver. His MELD score must hover somewhere between sick enough to need a liver and healthy enough to receive it.
If you're getting sicker, waiting for a liver transplant, you have a higher risk of complications, more time in the hospital, more stress with dealing with the disease, and ultimately a higher risk of death.
Dr. Ryan Taylor is Gary's doctor and the medical director of liver transplant at the University of Kansas Health System. He explains the recent change to organ allocation.
In the attempts to make things more fair, they took away those donor service areas, and they've developed a system called concentric circles, where they draw circles out from where the donor hospital is.
The impact on patients is huge.
By making these new circle model, they're trying to eliminate the disparities and try to share the organ access over a wider area than we had traditionally. So it's going to advantage some people who may not have access to the organs, but in areas where organs have been donated at a higher rate, those patients may be more disadvantaged now because the organs will leave those areas.
For Gary, some days are pretty scary.
Today, afraid. Some days we get a lot of good news, and other days finding out that our volunteer donor didn't make the cut was a real downer.
Gary sees a therapist regularly. He hopes to get back to the things he loves, the kids and grandkids, and his passion, music.
As Steve Martin would say, you can't be unhappy when you're playing the banjo.
Gary says waiting for a liver has changed how he looks at life. Gary Gray and his wife Beth are joining us live this morning from their home, along with his physician here in studio with me, Dr. Ryan Taylor. He is the medical director of liver transplant here at the health system. Plus, liver transplant recipient Amy Wallace is here. Amy had a successful liver transplant back in 2017 and was brought together with Gary through, of course, where else? Social media. We're going to explain their special connection here in just a moment, but I want to come straight out of the gate with some good news. Beth and Gary, tell us what's happened since we saw you last.
Well, we've been able to find that donor that we were looking for, and we're in the process of kind of negotiating the services to get a transplant done for us now.
Fantastic. Beth, what's it been like? Kind of tell us that I know this big relief has been lifted on you because you've been there by Gary's side this whole time, but what's it like from a partner's perspective going through this and waiting?
It's a roller coaster ride for sure, and it's worrisome, as Gary's health gets worse, and we know he can, we know that without a liver transplant, this is only going to get worse. And we know because of the the way PSC in particular, his illness progresses, a deceased donor transplant is unlikely in this environment. So, we've been through some ups and downs trying to find a living liver donor, and it's an extremely hard thing to ask of anyone. And then to find, it's touching to have the support of the community, our musician friends, our neighbors, the doctors at KU Med, Amy, to find an altruistic donor in the music community who is really willing to do this has been just phenomenal.
And we're going to talk more about why Gary needed to go in search of his own donor and just simply didn't have the time to wait on that list. I want to bring in Dr. Ryan Taylor. So Beth mentioned PSC. Tell us what that stands for, what it is, and is it common?
Absolutely. So primary sclerosing cholangitis is an autoimmune liver disease, and that's where your body attacks your bile ducts, which are inside your liver. And when this happens, you get scarring of these bile ducts, the bile doesn't drain, and it causes damage to the liver cells themselves.
So Amy, you were also diagnosed with PSC. You're also one of Dr. Taylor's patients. This was all just kind of a big coincidence. But how did you and Gary cross paths?
Well, we actually live in the same neighborhood, and I was just honestly on our neighborhood Facebook page where we all kind of communicate with things going on, and I had seen a post by Beth regarding Gary's transplant or need for one, and she had mentioned that he struggles with PSC liver disease, and that just made me think twice because that's exactly what I had, and it's not that common, and it is very chronic, and there's no cure. You just need a transplant. So it was placed on my heart to really reach out to them and just introduce myself, being a couple blocks away from them in the same neighborhood and haven't crossed paths yet. And so far that's what we've done, and I've met up with them several times, and I just feel blessed to be in a position now, 5 years later, that I can offer him and her support and encouragement and kind of validate what he's feeling, what he's going through for what's to come. And feel very fortunate that our paths crossed like that.
Yeah, I think you were visiting with Gary just yesterday. I think it's so interesting. Same doctor, same liver disease, and same neighborhood. And you really made that step to reach out because you knew how much support Beth and Gary needed. I think that's fantastic. Gary found this living liver donor, but Amy, you were healthy enough, and I use that term enough, widely, but you were healthy enough to wait on the list for a deceased donor. Tell us what your wait was like.
It was actually pretty long comparatively. I waited 1.5 years. I will say when I got on the list initially, it kind of shocked me because I didn't feel like that felt like a big step. And at the time, I thought that was maybe not necessary at the moment because it felt like such a big thing to be waiting on a liver transplant. I was still hopeful I could get cured. But I'm so happy I got on that list early because it was 1.5 years. And that last 6 months was really, really hard. I slept as much as I could, probably 20 hours a day. I had no energy to do anything. And it wasn't certain that I would get called. And so I never had to take the step that Beth and Gary have had to do, which is go out and ask the community, can anyone be of this service to a stranger to donate? But that would have been my next step had I not gotten that call. So it's a trying process for sure, and I'm extremely grateful I did get a deceased donor, but I'm very happy that Gary has the opportunity to ask for a living donor and that it looks like it's going to work out.
So how are you feeling now? You seem, you look, you sound fantastic. How are you feeling? What does Gary have to look forward to?
That's the best part of meeting anyone that's waiting because I'm so excited to share with them what's to come. I think it means a lot too to share where I've been, and yeah, these pictures kind of remind me even of that. I had a 4-year-old boy, he's now 10. I've even added another son to our family, so he's 9 months. None of that would have happened unless I got the liver transplant in 2017. So my life, I honestly feel like I've lived 2 different lives. But it's really exciting to go out now and encourage people that I cross paths with and say, you can do this, it's going to work out, and just give them hope. Because it's really easy to lose hope when you're waiting on something that drastic because it's either you'll make it or you won't. And that's the hard reality of it. Mm-hmm. And I'm just grateful I did. And I have a lot of faith Gary's going to as well.
Dr. Taylor, we talk a lot about our robust transplant program here, whether it be heart, liver, or kidney. What's unique, though, about a liver transplant Is it risky? What is going on both sides of that coin?
Absolutely. A liver transplant is one of the biggest operations you can get. There's a lot that your body has to go through to be able to get the liver transplant. I think Amy's pictures that you just saw with that large incision tells the story. It's one of the biggest incisions you can have. The recovery time can take a while, and to build your strength back up and to be ready to go back to work and regain your life takes some time. But certainly liver transplant is better than the alternative, as Amy mentioned. If you get sicker, we don't have a lot else to offer besides that.
So we're talking about two types of transplants. So Gary went in search of a living donor. Amy had a deceased donor. So what type of liver transplants do we currently do now here at the health system?
We just do deceased donor transplants.
Okay, but there are plans to expand our liver transplant program. Tell us a little bit about what's in the works.
Absolutely. We've identified that there's been a gap in our services with the changes in the organ allocation, and we've seen more and more patients like Gary that would benefit from that living donor option. And it's not something historically we've needed here. We've had so many donors that we've been able to keep up with the need of what the patients had and what the organ offers were. But now with these changes, we find that there's a gap, and we want to address that. So we're actively in the process of putting together the right team, the right approval process, and all the policies and program changes that will be needed to offer this in the future.
It takes a lot of special training.
Absolutely.
And like you said, a lot of pieces have to fall in place, but to know that that's in the works is very exciting, because
Absolutely.
This is something that Gary would be able to stay right here. He's going to be one of those stories that we look back and we have Gary back and say, you had to go far, but now we'll have patients that we get to have on that say they get to stay here and do it right here. Gary, that must feel good knowing that other patients won't have to go through what you went through and be able to stay close to home, right?
Right. It does mean a lot, because one thing I found out is that having a group surround you and nurse you back to health is worth $1 million, and certainly your family being local would make that process a little more comfortable. Not a lot more, but enough.
Well, and also there were a lot of candidates that came forward that were interested in being donors, but really just could not be away from their family for the recovery period required. So I'm thrilled to hear that, Dr. Taylor.
I knew you would be.
Plus the facility at KU Med is amazing, and we have so much confidence in it that that would be our preference if they offered the service.
So we're going to put a QR code up on the screen right now. I'll take you to the latest information on our current living transplant program, more information about all the topics that we're talking about here today. But we want to give you a little bit more background on why Gary had to look for his own donor rather than sit and wait on that list. The liver allocation rule changed in February of 2020, but the legal challenge over that change continues on. The litigation is going through the discovery process right now. So in the meantime, patients like Gary and Amy are two contrasting examples of how the change in liver allocation is impacting patients. Our doctors, including Dr. Taylor right here, he predicted that this would happen. I want to show you some numbers. This graph shows the number of available livers in our area from deceased donations holding steady, even going up during 2020 and 2021, even during a pandemic, if you can imagine. But there is a significant drop in the number of transplants performed here at the health system, while the MELD scores of those patients creeps higher and higher. So Dr. Taylor, dive into the MELD score again. Explain to people exactly what that means and why it's such a touchy number that we have to keep track of.
Absolutely. So the MELD score takes 4 common blood tests that are very easy to order in any clinic or lab, and we put it into a calculator, and it puts out one number. And this number tells us a lot. It's related to the prognosis with liver disease, and we use it to rank order patients on the liver transplant list.
So where are the living donors going, or the donors going, the deceased donors going, if they're not going to our patients?
So the organs that are being donated are now being pulled to the high density population areas, such as the areas on the coast.
Which means, some good news for us, we're doing our part. I always like to mention that. Tell us what that means.
So we have one of the highest organ donation rates anywhere in the country, and that's credit to our local citizens and all the hard work that's done in the community to raise awareness about liver transplant. And so that's wonderful and great for the overall organ donation process, but it is hard for patients who are in our community and actually need to access those organs, and then to see them not be available when their time of need is there.
So let's talk about Amy then, for example. Had she needed that liver today, she'd be waiting, getting sicker and sicker, right?
Amy was tremendously sick right before her transplant, but she probably would have had to wait longer in the current system, and that just breaks my heart to see patients suffer and struggle with already a difficult process, and then to add more worries, concerns, and opportunities for challenges just makes it even worse.
But that's what your job is. Your job is to keep patients like Gary as he waits and tries to find that living donor, or Amy who's waiting on the list. Your treatment plan is to keep them healthy and keep them healthy enough to receive that transplant when it comes their way, right?
Absolutely.
So what is life like for them? And I'll ask Gary next, but what is it like for those patients as you're trying to kind of keep them steady and in good health?
Absolutely. You know, dealing with liver disease is one of the hardest things, and it really breaks my heart to see good people really struggling with severe symptoms and just all aspects of their life getting impacted. I know Gary loves his music, and to see the days where he's not as able to pick the banjo strings as well as he does is a hard thing. And Amy's such a bright, vibrant person, and the smile she has was always there, but it was a little bit less of a smile when she was so sick and jaundiced as you see in those pictures. So these diseases take so much out of people. It affects your ability to think, to be awake, to be aware. You're dealing with swelling, and you're all puffy and full of fluid. You can have bleeding, infections, all sorts of things. It's just any given day it could be a different thing that you're dealing with, and patients are in and out of the hospital. You never just can't really make plans of what to do next.
And that's kind of what Gary was saying. How has it been for you? I know just emotionally knowing that this is going to change for you soon, but what's it been like? Certainly these last 6 months, Gary.
Well, it's what the doctor said. It's boring. It's monotony. It's sometimes hard to get out of bed. It takes on a life of its own. And you know, thank God we found someone like Amy in our neighborhood who can speak to what it's like coming out of that cloud. You know, overcoming the pain and seeing and becoming whole again. It's an amazing miracle.
Okay, a fun story though about Gary. We did this story with him out kind of in a park setting on a bench together when we were visiting. And usually when I'm talking with somebody, I try to find that little nugget about them that they're withholding, that they're holding back. And he said something like, well, I'm really into music and I play the banjo. I said, aha, I knew there was something that you do. And so I said, how can we get you to play the banjo? So of course, with the help of Beth, I begged him to let us come over and find that banjo case, and she brought it out and he was able to do that. It was nice to be a part of, but it's just finding those little moments. And I love the connection between this community of people dealing with this chronic illness coming together and helping each other. Beth, the transplant is soon. What are you looking forward to celebrating most when you get your old Gary back?
I just want to stand outside in the fresh air and breathe in the sunshine. That's really all I ask. I'll get to see my grandkids again. I'll get to see them all growing up, and because they're growing like weeds, as I'm sure you know.
Yeah, the simple things. What are you looking forward to, Beth? I know you guys like to get out on the road and travel with your bluegrass community.
I want to. We have a family kayak trip we take with the kids and the grandkids, which we haven't been able to do. It'd be amazing if we could do that, go camping and kayaking. Just having a husband-wife conversation, the encephalopathy, I can't say that right. The hepatic encephalopathy has been a challenge and frustrating for him too, have him not be so fatigued and be able to be more engaged in life, because he normally is so engaged and hilarious, and having that Gary back is going to be amazing. There's just so much.
Dr. Taylor, I want to ask you about some new research on non-alcoholic fatty liver disease. It's one of the most common causes of liver disease in the U.S. The University of California, San Diego School of Medicine found that parents, siblings, or children of patients with non-alcoholic fatty liver disease are at a 15% risk of developing the condition. The study found that early screening can be key to successful treatment or prevention of severe scarring of the liver, which could then reduce the risk of liver cancer, liver failure, and of course that ultimate need of an organ transplant. Liver disease is often called the silent killer, with most patients showing no pain or symptoms. Like, how helpful is this research going to be in helping determine where people stand?
I think it's tremendously helpful to identify these patients early so that we can do everything possible to make interventions and try to slow down disease progression, because liver disease is something that doesn't happen overnight. It doesn't happen in a week. It's a disease of years and decades. And so the sooner that you can identify patients with problems and at risk, we can make a big impact.
So who is at risk of non-alcoholic fatty liver disease?
Pretty much anyone is. We've seen it
Really?
in patients who have problems with their metabolism, but we've also seen it in patients not necessarily with those issues. And so it ties into your diet, it ties into your activity level. Of course, some genetics play a role in it. And so we see it across all the spectrum of young, old, small people, large people. We just see it across the basis.
No one's exempt. All right, let's check in with Dr. Dana Hawkinson, Medical Director of Infection Prevention and Control, with our COVID count on this Friday, heading into the weekend. Good morning. How are you?
Hi, good. So yeah, COVID count numbers have slightly and steadily increased a little bit for our active COVID infections. Right now we have 28 active infections, creeping up closer to that 30 as we were down closer to 20. Of those 28, 2 in the ICU, 0 on the ventilator though, which is good, and 16 in that recovery period. But again, we are also really dealing with a significant number of influenza admissions here as well. The RSV admissions have decreased within the last week, so that is good. But unfortunately, yes. From the last 2 to 3 weeks, based on the CDC weekly reporting data, we know that cases and virus circulation have gone up, and I'm hoping we are not getting into seeing more hospitalizations now, because we do know hospitalizations tend to lag by 2 to 3 weeks from those reported cases.
So a record 40 million children missed measles vaccine doses last year.
Yeah.
That's according to the CDC. Unvaccinated children are at the center of an outbreak right now of measles in central Ohio. What is your concern level at this point?
Yeah, it's very high. You know, Dr. Shoemaker mentioned measles specifically yesterday, but it's not just measles, it is the other vaccine preventable diseases as well, and Dr. Taylor can comment on this also. We know that for our transplant population, it's vitally important that they receive those vaccinations before going to transplant. For our children, you know, it is vitally important that we protect them and get them those vaccine preventable diseases, which are extremely safe, but and also save from significant mortality, morbidity, illness of those children. We don't really have a good idea for what those disease causes, because most of our generation and before that have had those vaccines, so we don't understand the impact of those illnesses on the community, but on that individual as well. So it is extremely important. One other infection that we forgot to mention that I talked with Dr. Shoemaker today about, polio as well. So it's not just measles, but it is all of those other preventable diseases that can be quickly, outbreaks can be stopped and infections can be stopped if we get those safe vaccines into the arms of those children.
Any reporters on the line today? Let's get to our community. We've got some good questions coming in. Aaron wants to know, Dr. Taylor, what's the average amount of time somebody might wait on the list for a deceased donor, liver donor?
So for liver transplant, the waiting time is determined by this MELD score. And so patients who have higher MELD scores get transplanted quicker, and patients with low MELD scores are going to wait. And so really it depends on how sick the patient is. The whole system is set up so the sickest patients get transplanted first. So I can't tell you that amount of time. It certainly has gone up for patients in our middle MELD scores because of these changes, that before we would transplant patients with a middle MELD score, and now they have to have a high MELD score.
Riley has a question for Amy. Amy, how has the liver transplant, how has it affected or impacted your life? I know you had a baby since you had your transplant. Tell us a little bit about that and how you're feeling and how it's impacted you.
Yeah, thank you. I had to have a transplant, I think I was 30 or 31 years old, and so I had a lot of life left to live, and I was excited to get back out there. I didn't know that the beautiful blessing of another son would arrive last March, but I'm so grateful for that opportunity to be a mom to 2 boys. When I was going through the transplant process, my older son was only 4 years old, and it was really hard for me to imagine him losing his mom, and me not making it. But that was something on my mind way back. I didn't want to give it much attention. So just the fact that I can be here 5 years later, not only healthy for my oldest and for my husband as well, but also to bring new life into this world, it's given me a chance to have a family. When really I was so sick, I couldn't give any time or attention to my family at all. So it's a true blessing, and it's from the donors, and I'm very appreciative of that.
Bob wants to know, Dr. Taylor, worst and best foods for your liver.
Absolutely. So the worst thing I would say certainly is alcohol. So that's one thing if you're concerned about liver disease that you want to avoid. But as far as foods go, you want to avoid things high in sugar, saturated fats, processed foods. The more simple ingredient foods or simple recipes are going to be the best things for you.
Not always easy to do, but certainly something to do in big moderation.
Absolutely.
What do you think the future holds when it comes to liver and other organ allocations? Angela's just curious, what would you like to see happen in a perfect world?
Yes, I'd like to see a world where all patients have equal access to organs. We still have a long way to go with our current system. I know it's being looked at, and maybe even another few revisions we will see as we try to make this as fair as possible, but also recognizing to have the best outcomes for the organs. And so as doctors, we're trying to make sure patients can get the organs when they need it, but we also want to make sure that the organs have the best outcomes because there is that shortage.
Sheila wants to know, what's the most common reason someone is unable to donate a portion of their liver to someone?
Usually it has to do with the donor having other health problems that sometimes are uncovered during the evaluation process. Sometimes patients can have anatomical reasons why their liver doesn't have the right blood flow or right setup for the surgeons to have a good outcome. And actually, fatty liver disease is a very common reason patients are excluded. They go for the physical to be evaluated for a donor, and lo and behold, the donor is found to have liver disease and fatty liver. So unfortunately, that happens quite a bit.
So Jeannie wants to know, can a person designate the geographical area they want to donate under the new regulations?
Unfortunately, no. It's considered an altruistic gift.
Yep.
And so when you do that, the concept is that you're just giving a gift, and that's what it is.
And then Lindsay wants to know, what's the difference between, and just surgically speaking, but then just lifespan of receiving a living donor versus a deceased donor? Is there a similarity in the surgical procedure, and then what about the post-surgery?
As far as the surgery goes, it is a little different because you have to coordinate with the donor at the same time, whereas a deceased donor, there could be a few hours or changes there for the transplant to occur. So you have to coordinate with the donor, with the living donor. The operation is more technical because you're actually only taking part of the liver. You want to make sure that the donor stays healthy and has enough liver to continue to be stable, and then that when they put the new liver into the patient, that everything's been addressed so they don't have any complications.
I want to get to final thoughts today. I love this story and I love this conversation. I want to start with Gary and Beth. Just your final thoughts from both of you. We've got some exciting news, and I can't wait to talk with you after this transplant is over. But in the meantime, what's your final message today?
My final message would be rely on your support team and make good use of them, because there are people out there who are willing to do amazing things. And that's the reason I'm able to sit here and have this conversation, is that somebody is making a sacrifice that really would have been unheard of years ago. So I think you just need to rely on your family and God and see it through.
Beth?
My last thought is just a request. We still have a long way to go. We've got to get Gary and his donor safely across the country without getting flu or COVID. So I'm just going to broaden our support team and ask everybody to be sending thoughts our way, because as I'm watching your news report, I'm thinking, yeah, we still do have to get them across the country. So again, keep rooting for him, please.
We are rooting for you, praying for you, and it's such a really good point, though. I mean, finding the donor, that is such great news, but the journey isn't over, right, Dr. Taylor?
No, it's not.
So much more to do, and I know you've got this great support team, and one of them being Amy. Amy, I want to get your final thoughts, and I know that Beth and Gary adore you and appreciate you, and I'm so glad y'all found each other. Your final thoughts today.
Yeah, thank you. I just remember after surgery that it was such a drastic difference of my life, because I had fought this disease for almost a decade, slow progressing, but knowing I'll need a transplant to survive. And it was almost like a break. And for that first week or two, especially coming home, I thought, this is a great break from not having to survive every day. But then day after day, that break lasted. And it was having to change my whole thought process to a new normal, a new way of living, which is actually actually living. So you kind of get stuck in just survival mode for so long that you don't realize what life truly is. And once you get it back, you're just shocked. And I remember thinking, this is how people feel. Like, you know, I don't get much grace for people that complain much anymore because they have no idea how bad it could be. So I'm so grateful. I'm thankful I can use my story for good as I move forward in life. And you know, I'm grateful for all the donors that have signed up as to be a donor at death. And I just encourage everyone to give that some consideration, because me and Gary both wouldn't be here unless there was selfless people like that in this world.
Well, and we appreciate your selfless act of sharing your story. And yes, Beth, you had something to add.
I just want to add something to that. Amy and Lindsay and Gary and I have been talking, and now that I hear what Dr. Taylor has to say, we would love to be the cornerstones of starting a support group as you have living donor transplants locally, to try to make sure that the support end of it is available to people in your program, Dr. Taylor.
Well, thank you. That's very generous, and we'll be in need.
But she'll let us say her first name.
Fantastic. Exactly. You're great stewards, and you're great just to share your story, because we can't educate the public and share these stories and get the information out without patients willing to talk and open up. And I know, Dr. Taylor, you appreciate that so much. And your final thoughts on this Friday?
Absolutely. I just want to highlight again the importance of organ donation. This whole process only works if someone makes an altruistic gift of that nature, and so we have to make sure everyone's aware of organ donation. It is the season of giving approaching, and so that's the ultimate gift someone can give, is an organ.
And that's why we put that QR code up, because I think people want to give, they want to do things, but they don't know if they can. And so it's great to know that you could just find out more information, ask questions, ask your doctor, reach out to Dr. Taylor, click on that QR code and find out if possibly you could donate. Dr. Hawkinson, your final thoughts today.
Yeah, thank you to our guests, and obviously working with Dr. Taylor as well. And I think good questions from the community. I think it's vitally important to continue to endorse, especially with the question in the headline about the measles outbreak. You know, these viruses are continuing to circulate. They are out there. Protect yourself, protect your children, your loved ones, please. Go get up to date with your vaccinations. Again, talk with your medical professionals, your physician, talk with your pharmacist. Just get protection, because it protects you, but it also protects your community for things like measles and mumps. When you can get that vaccine and polio, that herd immunity that we've heard so much about during COVID really is applicable here for these things. So it is vitally important to keep yourself safe and your community safe.
Thank you all so much for being with us today. You can catch our updates anytime by logging back onto Facebook, YouTube, and Twitter. Have a fantastic weekend. We'll see you back here Monday at 8. Coming up Monday on the Morning Medical Update, the pandemic claims another victim, and this time the trickle-down impact is hitting hospitals and seniors hard. I'm Jessica Lovell on the next Morning Medical Update. Isolation and fear over COVID led to a drop in volunteerism, which after 2 years has led to a change in habit. We talk about the psychology behind what's happening and how you can help fill the volunteer void. We'll see you Monday at 8.
Subscribe to our Morning Medical Update and Open Mics with Dr. Stites podcasts. Now everywhere podcasts are available.